I was diagnosed the week of my 49th birthday, and I was so fearful that my life was going to be cut short. By walking through this whole journey and having phenomenal medical oncologists and all of the wraparound support services at Loyola, my mantra has now become, I'm going to emerge from this 50 and fabulous. In February 2015, I had my annual mammogram. Suspicious results, pretty quick progression, biopsying, determined that I had malignancy in the right breast. I was referred by my OBGYN to Dr. Gadelis and Dr. Albane at Loyola. Within 3 days, Loyola had me scheduled in their comprehensive cancer clinic.
When you find out that you have breast cancer, you need to learn what kind is it. There's not just one kind. The treatment is directed to the particular subtype. And so in her case, the subtype was called triple positive. What that means is that estrogen receptor, progesterone receptor, and HER2 receptor, 3 different signaling receptors on the surface of the breast cancer cell, all of them were turned on in her particular tumor.
I walked back out of the door after our meeting with the comprehensive cancer clinic more confident that I had a very hopeful prognosis for my future.
The specifics of the size of her breast tumor dictated that we needed to give treatment first that would travel throughout her body as well as the breast before she had any surgery. So she received 2 types of antibodies that help the immune system fight her particular cancer. In combination with these 2 antibodies, we also give a chemotherapy drug. And they work synergistically or in tandem as partners to allow optimal killing of the cancer cell. Dr.
Albane advised me to stay healthy and work out and eat well, and I sought out the dietitian on staff and have been given wonderful recommendations as to what I should be feeding my body. I joined the fitness center, and everything I do in the fitness center is approved by Dr. Albane. I've taken advantage of the Coleman's Image Renewal Center, and all of those things have not only helped me physically but also emotionally helped me process this life-changing, devastating cancer diagnosis.
In her particular case, she had a beautiful response on the first MRI, and at that point we switched therapy to different drugs to attack the cancer in yet another way. And so because she achieved that type of response, her survival outcome is predicted to be extremely good. But that's not enough treatment. You can't stop there. You have to continue that antibody therapy, those 2 drugs against that HER2 receptor for a full year. And so she's in the midst of that right now.
The cancer, while it might be gone from my breasts, is so aggressive that it may try to attach itself or regrow in my body, and I'm confident that the drug that she has selected for my cancer is a necessary part of my healthy regimen, my healthy treatment going forward.
She is a perfect example of how we attack breast cancer on many fronts now. And it's very critical that patients see a team. A multidisciplinary breast oncology center such as Loyola's here in the Cardinal Bernardine Cancer Center is critical for the management of breast cancer.
Every interaction I've had at Loyola has helped strengthen my spirit and my resolve to not only fight for my life with the cancer diagnosis, but to fight for a phenomenal life and a vision I have for myself going forward.